Good afternoon, everybody. Thank you for being here. Happy New Year to everybody. Let's go through the data and touch on some newsworthy items and then take some questions. Unfortunately, we lost 6 individuals over the last 24 hours. Caucasian female in her 70s, Caucasian male in his 90s, a Caucasian male in his 60s in the hospital. We lost 3 more residents in nursing homes reported through the New York State Department of Health. So certainly another sad day. Want to keep these families in our thoughts and prayers, and all the families of those out there that have lost loved ones. Looking at our positive rate, 7-day average, 7.8%. Certainly some of the cases, when you do your investigations, some of these things could have been handled differently, but the reality is we are in a part of the year that any virus is going to do better, and what we need to do is stay balanced, compare ourselves to where our peers are, where we can make improvements, and that's what we're doing with our strategy. So overall, since Christmas, we've seen an uptick. It looks like a slight surge right now. It doesn't look to be as bad as Thanksgiving at this point, but we'll see what the next few days bring us. Hospitalizations have stabilized from their highs. 311 individuals are in the hospital in Onondaga County related to COVID-19. That's up a couple since yesterday. The 48 neighbors in the ICU, that's down 3 from yesterday. Overall, I believe we have 33 residents who are now waiting to get transferred to our COVID transitional site in partnership with Loretto. That's important. Over 42 residents were transferred last week from hospitals to this facility. We're going to open up a second floor there, and that will free up more hospital capacity. So even that's an important part of maintaining hospital capacity. The other promising note is that the vaccination is getting into the buildings, into the nursing homes. Right now, there's been over 2,000 doses in nursing homes. Our adult and long-term care department surveyed the various senior facilities on who's been essentially received the vaccination, who's still in line to receive it. The governor addressed this issue today. The federal program's not moving fast enough. We've offered the state of New York to do the vaccinations if they give us the vaccine for the remaining facilities. So I know that is something that is a priority. It's a priority of ours. But we have, most of our nursing homes have received the first dose. It's our assisted living facilities who some are still waiting to be scheduled through the pharmacies. Those are the ones we really are pushing to get into there. We've done testing in these facilities. We have relationships. So if the state can get the vaccine from these pharmacies, they can do it themselves or they can have us do it. We're waiting for an answer on that. Looking at, and again, why is that important to hospitalizations? And I'm talking about it right now, not in the vaccine part of the program here, is because 25%, this is the pipeline, 25% of our hospital numbers today are nursing home residents and senior facility residents. When you look at our loss of life numbers, it's over half, not just what's reported in to the state as far as deaths, but we have residents that are going from nursing homes to the hospital and losing their battle with COVID in the hospital as well. So the vaccinations are really important to preserving life and preserving hospital capacity as well. Looking at new cases, 327 new cases. The nice note out of the 327, our best note, is only 3 of them are senior residents from senior facilities. So we've seen a trend over the last week of a pretty substantial drop-off in percentage of cases from nursing homes and assisted living facilities. We believe that's because the vaccine has been administered in these buildings for the most part. And so, again, that's very good news out of the 327. Related to total cases, we now have over 22,010 total cases since March 16th. Looking at the other demographics, 11,760 female, 10,123 male, 19 and under, 3,371. In their 20s, 4,409, 30s, 3,287, 40s, 2,706, 50s, 3,179, 60s, 2,370, 70s, 1,300, 80s, 874, and 90s, 514. So with cases, we saw the next few days will tell the whole story related to Christmas. Then we still got to see what New Year's brings us. But we had an uptick. It doesn't look right now, we'll knock on wood, it's as strong as what we saw on Thanksgiving. We always have high case days, Thursdays and Fridays. That has to do with national labs reporting as much as anything else. Not that you had that many people go to get a test 48 hours or 72 hours before. But certainly the next few days will help tell a story of how strong the Christmas surge was. We were prepared for 600 and 700 cases a day as far as investigations go. So we were ready for it. Right now, thankfully, we've not had to investigate that many daily cases. Looking at testing again, part of our strategy now, more important than ever, after a time period where we know there were gatherings. I think people probably celebrate a little bit smarter than they did before, but now we need to identify the virus, identify it as quickly as we can so we can isolate it. So testing is the key component to that. If you're sick and symptomatic, please go to ongov.net/KUGMedical. Monday through Friday, 9 to 2. Register for appointments there. Again, weekends, testing is at Essentia Health, not at the FSHOD, same website. But again, if you have symptoms now, go on, register, go to the FSHOD, get a test. If you're asymptomatic, you're not showing symptoms, we have our asymptomatic rapid testing going on at the On Center again this week. For an asymptomatic rapid test, covid19.ongov.net. We've expanded this testing into the community this week as well. Let me go over the community sites. Tomorrow we will be in East Syracuse Village Hall, as well as the Northeast Community Center. Wednesday we will be at the Arrowhead Lodge in Brewerton, DeWitt Town Hall, Fabius Community Center, Village of Fayetteville Senior Center. Thursday we will be in Lafayette Community Center, Onondaga Town Hall, and Friday we will be at Shove Park and the North Syracuse Community Center. So we have our symptomatic testing, we have our community testing sites for asymptomatic, trying to find those hidden pockets of the virus. We're also back in schools this week, so we're testing in various schools every day this week. School testing, important piece, making sure that there's not spread in schools. Remember, if you think about back to school, if you are an adult and you work in a school building or for a district and you're sick, you shouldn't be going to work. It's pretty crystal clear. If you're sick, you stay home. If you're a parent and you have a child that has symptoms of COVID, you need to keep them home as well, because if they go to school, the nurse is going to send them home. So from symptomatic individuals, that should not be happening in the buildings. Then the question is, how do we know there's no asymptomatic cases? We're doing asymptomatic testing. That will help us find any pockets. In addition to that, we've had a lot of success with the regulated environment in classrooms related to the distancing, mask wearing. Kids have done a very good job. Teachers have done a great job sanitizing. So when you put all these factors into consideration, it's a tried and true reopening for schools. This isn't any different. Again, we're going to have cases in the community. What we have seen, and we looked at the data after Christmas, the week after Christmas with K through 12. We studied it. Our epidemiologists and Dr. Gupta looked at it. And the reality is, if you have a driver's license, no matter how old you are, you're more at risk to getting COVID than if you don't. and there is no trends. There's not more cases the week after Christmas than there was the week before. And so that's something that I think is important, that as we go through this next month, it will be stressful at times. Let's let the data tell the story, let the data drive the decisions, and we'll get through all of this. Looking next at the vaccine, here we're in week 4. Here's the week 4 priorities. The vaccine and how it impacts our county. Again, regional hub of upstate. The state decides who gets vaccinating. They do the who. The when is always when the vaccine is available. And then the how, there's various hows. In our county, we're a little ahead of the curve. Our pod, our point of distribution for the vaccine at the War Memorial, it's not a secret anymore. You all know that. We had that where we're the first in the state to have that opened. Last week we were vaccinating. The vaccine was redirected from hospitals to us so we could expedite the vaccination process. That's how it worked last week. This week we have some more redirected vaccine, so we'll continue to do 1A. In addition to that, we should be receiving vaccine directly from the state this week. So as we know we'll have vaccine, we will staff up and we will extend hours until we maximize the capacity at the first pod. Once we've exhausted that capacity, we will open up a second pod in the community, and then we will open up a third pod. But we're not going to open up those pods until we have the commitment of the supply, so then we can let the public know. The last thing we want to do is go tell the public, go register for the vaccine on this day, and we take 700 registrations and we don't have any vaccine. So that's how the process is going to play out. Last week with the redirect, we vaccinated in our pod over 1,100 residents. This week we will vaccinate thousands of residents under the assumption that the vaccine from the state DOH shows up and we have the vaccine available. But we already have pre-registered thousands of people to get vaccinated this week. They're there right now getting vaccinated. It is not open to the media. Very strict security protocols, but that's how this process is going to play out. We'll have more pods. We'll get it out. The hospitals will vaccinate. Eventually, you'll have primary care providers most likely vaccinating as the phases move forward. The governor highlighted some different creative approaches to get into underserved communities. I'm sure there'll be more meat on the bones of those plans as this process plays out. But I think, just to reiterate this is critical, and this is probably the most important work I will ever do as your county executive. I want to vaccinate 467,000 people, and I want to do it yesterday. There's not 467,000 doses of vaccine. 100,000 people in our community are not even legally eligible to receive the vaccine yet because they're children. So who we have eligible is about 360,000, maybe 367, depending on census numbers. And then not everybody's going to want a vaccine. It's our job to educate and let people know it's safe. But again, not everybody's going to want one. So then how do you get the vaccine out as quickly as possible? When we know how much vaccine we have available, we will, and the state says we'll send you this amount, we will staff up and meet that challenge, whether it's 1 pod, 2 pods, or 3 pods. But right now with our existing pod, we have a lot of capacity to build up to, and certainly we think we can handle 1A very well at the one site. Once 1A becomes more comprehensive, and potentially you start looking at second shots for 1A, we may need a second site. And then 1B, where the state hasn't said exactly what 1B is. We'll wait for that, but everybody's thought process is 1B will get more expansive, and then we'll need multiple sites. So that's the vaccination. Case investigations, A little bit busier over the last week, right? We had an uptick in cases from Christmas. Our texting technology has helped with that. Our own surge plan has helped with that. We're staying in front of investigations. Again, if you get a text from 833-634-1564, it's related to our investigations into the positive COVID case. So I want to thank people. About 40% of the people who've received the text have filled out the questionnaire. Thank you. That helps out tremendously. It helps out the contact tracing to begin faster, and it helps get us important data. So I want to thank the public for that. Another thing, and we've been talking a lot with Syracuse University about the start date. You saw the chancellor put out today pushing back the start date for the second semester. I want to thank the chancellor and his team. The collaboration has been fantastic, giving us an extra 10 days to work through and understand what these surges look like and then mitigate them is beneficial. So I want to thank SU again for their partnership on that, and we'll continue to work together moving forward. And eventually we'll get a second semester going on campus. Questions?
Ryan, how many vaccines have you been promised this week at the pod?
We're hopeful, Tim, that we'll have between the redirects from other hospitals that we were approved of. Remember last week, how we were able to vaccinate is our pod got approved, and we had vaccine at other hospitals in the Central New York region. Redirect forms were requested to redirect that vaccine to the county. The county, those were approved. But essentially, we think this week, between redirect a pre-approved vaccine being given to us and the state vaccine, we could be looking between 5,000 and 6,000 doses.
How many hospitals is that being redirected from?
That was last week from 2 hospitals. So again, we can do more, Tim. And look at pre-registrations help determine this too. Do you have the vaccine? Do you have the people? We've helped out in this process with some. Today, not everybody who's getting vaccinated lives in Onondaga County. They live in Central New York as well. Obviously, it's regional vaccine distribution. What happens in the surrounding counties is going to impact us. So we're here to vaccinate as many people as we can in 1A. Once we get through 1A, we get on to 1B. So, but we think that we'll have about 5,000 to 6,000 doses this week. If we get more, we'll vaccinate more.
And you've also offered to go into assisted living facilities or nursing homes. What's your ultimate capacity, you think, on a weekly basis for how many total vaccines you can?
Yeah, so that's a little bit easier because we can have our health department go in and oversee with their medical teams. So you don't need as many people to do that. And so that's actually easier for us to probably get done quickly. And I know the state's been talking to us about this, and we've been talking behind the scenes about how some of the pharmacies are just better than others. Some of them are pretty strained right now from this. That was a big task to take on all these facilities throughout the country. And so it just wasn't working as fast for us. So that's easier for us. We're ready to go. We could probably do 2 different teams, 5, 6 people per team, and go in and work with the medical directors in those buildings. Again, these are more our nursing homes, with the exception, I believe, of 2 of them or 3 have already received the first dose. So they're fine. It's these one of them I know is scheduled this week. It's the ones at the assisted living facilities that aren't even scheduled yet that we're really concerned about. So I think either the state's going to come in and do it, or we'll do it.
Has that happened elsewhere in the state, that counties have gone in to take over the nursing home operation?
I don't think anything. I think the governor announced it today that this is a new initiative. We're willing to participate in that initiative. If they don't need us, they don't need us.
Syracuse and North Syracuse school districts are not going to be in person until the 19th now. I know you touched on a little bit about the data and everything, but have you been hearing from parents and teachers who are concerned about going back to school because of these numbers, or do you think that they should start school because of the data?
Yeah, I think there's not a one-size-fits-all approach for school districts, right? So I have data where I have a town that has 17 active cases. That town doesn't have a single child as an active case. Why wouldn't they go to school, right? So I think you can't just say one size fits all. The city school district, the city has the most active cases out of any part of our county. We've offered to superintendents to share the data and explain the data by the people who understand what the data tells you, which is our epidemiologists at our health department. If they have concerns or they're on the bubble of the decision. For the first two school districts, they had their own metrics to make their decision. But everyone else started today. We're going to do the testing. We looked specifically at the trends related to kids with the assumption that adults aren't going to go to work sick, right? We're adults. We shouldn't have to go to work sick if we're sick. And the trends said that there wasn't growth the week after Christmas, whereas the week after Thanksgiving there was growth. And we did have school the week after Thanksgiving. So week over week growth. That I think overall that the districts have the ability to make this decision. How's your workforce impacted? Are your workforce in quarantines? But the data shows you that if you have a driver's license and you're mobile and you socialize, you're more prone to get this. And so I'm confident and comfortable that when we do the testing in the schools over the next month, we'll see very low positive rates because right now they've been in the community, which has a higher positive rate for the last 2 weeks, and we haven't even seen growth in cases over the last 2 weeks when they're in the community. The community was higher positive rate than schools before.
Ron, we're in week 4 now. We see the graphs pretty clearly here. But for the average person, is it still difficult to explain to people when they will get the vaccine if they're not one of the people designated here? Is it still difficult to explain to people the process of who is first in line and who follows?
Yeah, so and again, we're not, this isn't our call, right? So we'll reiterate that every time we speak about this. The state's doing the WHO and the eligibility. Their strategy, though, is clear, though, right? It's the individuals who are working on the front lines with the virus and who have to care for people who may or have interaction with people that may be sick. So the strategy is get those folks the vaccine first. My belief is then you're going to look at phase 1B will be more expansive of the community's vulnerable and other essential type employees. That may change, but what we are doing, how we can contribute, and again, the state has the authority on this, is we can set up an infrastructure that when you give us a category of folks and you give us vaccine, we get them vaccinated and we get them vaccinated quickly and safely. And that's what we've built. And we can scale it, and we have the ability to scale it and do quite a bit. Can we do it all alone? No, we can't. Not if we're going to do this in a timely fashion. But we have the ability right now, if we had a commitment that at the end of this week we would have so much more vaccine, we have the ability to go open up a second pod very quickly and then essentially double what we can do at the first pod. But you need the vaccine to do that. And I think that's kind of getting lost in the national debate. I know there's a lot of talk about this. There is not ample vaccine sitting in a freezer somewhere and just not being pushed. The governor outlined some of the hospital numbers today. They would know that or not, but when we get the vaccine later this week, it will be used this week. Then we'll be asking for more next week. And as long as we have vaccine, we'll continue to administer the vaccine.
So in theory, you're going to do hopefully 5,000 to 6,000 vaccinations this week. In theory, you could do more than 10,000 in a week.
Yeah, I think this at one pod you're probably looking at the most you can scale up is probably 8,000 in a week, maybe a little more, just from the logistics of space, even in an arena. So what we would do if we knew we were going to consistently have 15,000 vaccines sent to us each week, we would have probably 2 to 3 pods open right away to do with that. But again, it's not like the state has 19 million vaccines at this point. The manufacturers are manufacturing this. The federal government's procuring it, and then they're distributing it to the states distributing it to the regions.
Is this the most you've gotten? How much have you gotten each week?
Well, last week was the first time. We wouldn't even gotten anything last week we weren't supposed to be doing any vaccinations at the county level last week. We got our pod approved and operating before anybody else, and then we asked for 2 of the hospitals who couldn't keep up with the rate that people wanted to see. We said, redirect your vaccine to us, and we'll start doing that for you. And the state approved that. So this week, at some point, we'll get vaccine from the state directly, where it's in our control, not redirected vaccine. And so this is essentially the first week that I'm sure other counties will be opening up their pods this week.
That's point still a little confusing, though, because there's been widespread frustration about this idea of vaccines sitting unused on the shelf. And even Governor Cuomo today, urged the hospitals to get their supplies used up quicker. So, do you know, is there vaccines still unused at upstate, or where's the delay in that?
I don't know if it's our region as much, Tim, as others. Again, I don't see this data that the state sees. I talk to upstate, and our teams work together every day, and Kraus and Joe's. So I don't think there's wide doses sitting there. I saw Oswego Health, one of the other Central New York hospitals, was actually #1 as far as they've gotten rid of their doses, meaning that they've administered their doses in the state. So great job for Oswego Health there. What we're saying is, and this is true, your people, when you have to vaccinate, and think about this, we know our community very well. Do you like going up on the hill to Marshall Street? Like, is it easy to drive there? Is it easy to park there? The answer is no, right? You can, ride a bike maybe. No, I don't know. Riding a bike's tough on Marshall Street, Tim. You're in good shape then. It's just not, when you're thinking about the fact that we have such a diverse community, urban neighborhoods, rural neighborhoods, suburban neighborhoods, all over the place, having your vaccination sites just be hospitals from mass vaccination part doesn't make a lot of sense. When it's your hospital workers, makes all the sense in the world, right? You get your employees done. They have the infrastructure to hold the Pfizer vaccine, which is different from the Moderna vaccine. So our pod, when they looked at the initial distribution of it, is your hospitals are doing hospital workers, right? And then you expand it a little bit. We got our pod approved. We probably last week, which is good. It would have been nice if we were approved a little bit earlier. But we started putting shots in arms last week, and that's what we're doing this week, and we'll do it in a big way. And if they want to send more vaccine, we'll do even more. And then next week, hopefully, we're scaling on top of that.
Are you able to give the Pfizer vaccine if it comes your way, or only?
It's more difficult because you have the shelf life is, so once it's open, and we don't have the Pfizer freezer infrastructure, the Moderna we do. So we're probably going to be administering the Moderna vaccine. That would make more sense for us.
Hey, you spoke about the terrible ravages this has taken in nursing homes, and I think you mentioned that over half of our deaths have been nursing home residents, one way or another.
Yeah.
Do you have the actual numbers?
Yeah, I know the trend, Tim. Again, I have my hospital death number, then nursing home death. I just know what I see. If I went back through every report, we might be able to figure it out. But even today, one of the individuals who died in a hospital, they live in a nursing home, right? So it's 4 out of our 6 today, really. Even though one of them was in the hospital, they came from a nursing home. So that happens, I would say, every day almost, where folks from nursing homes get really sick and go to the hospital, and some aren't going home.
In February, the Syracuse Crunch is expected to start their season. I know right now they said they're not going to have any fans. Are you hoping that maybe there'll be some infrastructure there that can house fans?
Yeah, I think so. It would be nice. Look, it'd be great if we could get this positive infection rate down into, below 5%. I think you got a pretty good argument for having some sort of fans when you're below 5%. We'll see, right? So we had, we just went through a period of time, a pretty rough patch if you think about it, right? We were preparing for much worse, so it's tough when you have these elevated cases every day. We're the ones working on them. We're the ones dealing with this, and it's very personal. But it could have been, when you try to balance it all out, and that's what we have to do as a community, is balance all the information, balance everything going on, and not get too high or too low. When you look at balance, it could have been worse. And the data shows that we're still, as a state, as a region, doing better than other parts of the country, much better. So that's kind of a tribute to a lot of people taking this very seriously. So we've gone through Thanksgiving, Christmas, and now New Year's. Those are really strong gathering points. So if everybody can take a breather now and just stay to your pod next 2, 3, 4 weeks, do what you got to do, but distance, avoid the gatherings. We'll get things going in the right direction again. It will happen. It was happening before Christmas. We were down to 5.5% for a positive rate, right? So if we didn't have Christmas, we probably would have, 2 weeks from now, we probably would have been under 5. So we can get there again. We just need everybody's help. And now it seems like we've kind of, I don't want to say we've survived it right now, but we absorbed these surges to date. And it's been painful, but we've taken these blows.
Ron, if you could dive in a little more into the decision for Syracuse University pushing back. How long have you been working with them on this? Is it a number-based thing? Could that date be pushed back again if things take a turn?
Yeah, I think the university's been very strong partners on this, working with us on the science and doing everything, doing all the right things. Could you have started school at the end of January? Probably. To give another 8-10 days to kind of starve this virus a little bit more in the community, the responsible thing to do. So we've been having conversations with, the university all the time. They're key partners in this, and they'll continue to be key partners moving forward. At some point down the road, we'll be talking about vaccinations at Syracuse University, right? Giving us in the community 10 more days to isolate and starve this virus will bode well, where when the kids come back, remember, when the kids come back, they're all going to be tested, but nobody's going to, people who have it are going to have to stay home, and then they're going to get retested here, right? And then if anybody got it between the time they left home and came here, they'll be quickly isolated, but they then go into the community. So if the community positive rates are very high, you got 15,000 new people out there potentially spreading it. So the chancellor, we talked, and he made a very wise decision by delaying it, and I think we'll be in a better spot on February 8th. I think is what he moved it to.
Anything of note from New Year's Eve as far as enforcement or any infractions?
Yeah, I mean, we always get, after the fact, we always get some stuff sent to us. Look at we know younger folks had some gatherings, right? If you look at our 17 to 35 demographic, it's been about 30% of our cases. It popped to 35 last week. It might even be a little bit higher next week. But it seems, again, that people did a pretty good job. And so remember, right now, this is perfect territory for any virus. This is the season we get colds. This is the season we get sick anyways. Now we have COVID-19 to deal with. So COVID-19 was always going to be more active during this period of time. Take away surges, the holiday surges. So now we've hopefully absorbed those, and now we'll start to get on the better side of this. And by vaccinating our most vulnerable, by getting more people vaccinated every day, we're making progress on this.
When would you estimate that you will get vaccinated?
I'll get vaccinated when it's my turn. So I didn't believe this actually, but there is an element of the community that is very concerned about getting the vaccine. I thought it was kind of done with, but part of the community is there. So with public leaders, I think in the beginning, the idea was with public leaders, you have them get a vaccine to prove that it's safe. But I think that element of the community is far less than the element of people that want the vaccine. So for me to take a vaccine out of order is not appropriate. So whenever I'm up, that's when I'll get a vaccine. I don't even know when that will be yet, right? We don't make those rules.
Brian, through the shared services plan, are you talking with other counties about taking over case investigations on more of a regional basis?
We are. We've had those discussions. We're looking at some of our other counties, really some smaller counties, smaller health departments, really in some surge scenarios. Cayuga, very tough situation there, and others. So we're looking at it. After the next 2-3 days, once we see where we kind of are, we'll know what resources we have to put into what really would be kind of a regional investigation team. And then they would take overflow investigations as a shared service. So that's something that we've planned for. We put it in our plan. We hope we're in a good position to get that implemented to help some of these other counties that are experiencing really harsh spread right now.
Just Cayuga, or?
No, it would be all of our regions. So it'd be we would look at doing it with Cayuga, Cortland, Madison, and Oswego. And again, if health departments are caught up, there's so much capacity per day that a health department can do, and then it's that extra, so that the goal being that you're doing your investigation in 24 hours and getting it out to the contact tracers. And so you would have a team that would hypothetically take in the overflow cases each day from the other counties, including Onondaga. Onondaga would have a number, and then anything over that number would go to this team as well. And then that team would then do the investigations, get them out to the contact tracers. So it's something we're looking at. I think by default, I wish I put this in our shared services plan, but by default, we're going to be doing regional vaccinations, right? I'm not turning away somebody who lives in Madison County right now. It's just not something we're going to do. So we missed that, though. So that, we won't be able to put that in our shared services plan. Other questions? Okay, thank you, everyone. We'll see you on Thursday.